Hormonal stimulation ensures the growth of multiple follicles with a maturation of more oocytes during one menstrual cycle. These eggs are later retrieved via a vaginal approach under general anesthesia. The number of eggs obtained depends on individual response of the patient to the hormonal stimulation. The response depends on the ovarian capacity and the reaction to the stimulation medication. The average length of ovarian stimulation is between 12 to 15 days. The stimulation drugs are administered subcutaneously with a very thin needle. The place of administration is the lower abdomen, according to the instructions of the nurse. The physician will prescribe a stimulation protocol tailored to you according to the hormonal profile and the ovarian reserve and ultrasound finding, and the used medication will be handed over to the nurse for dispensal. The medication should be stored according to the instructions that will be given to you by the nurse, and you'll have the instructions on the pamphlet. Improper storage may reduce the effect of the medication. When the medication needs to be kept in cold, it's better to keep it in a refrigerator. Please hand over the container at the clinic for disposal. Keep in mind that the injections are hazardous waste and need to be disposed accordingly. During the stimulation, approximately 2 to 4 ultrasound checkups are needed. After the final maturation of the oocytes, you'll be asked to come to the clinic for the oocyte collection. The collection itself takes place early in the morning, usually at 7:30. You should be fasting from midnight on. After the procedure, you'll be monitored in the clinic for 2 to 3 hours. The embryo transfer is done without anesthesia. It's an ambulatory procedure which is quite quick, that takes about 10 to 15 minutes. And it's performed approximately 3 to 5 days following the oocyte retrieval. The complications of ovarian stimulation are quite rare, but may happen. The early complication that we see most frequently is the bleeding from the vagina after the oocyte retrieval, and this is usually dealt with shortly after the procedure. In very small percentage of patients, sometimes the abdominal bleeding occurs. That's why we always keep the patients for 2 to 3 hours after the procedure in the clinic. The most common late complication of ovarian stimulation is so-called Ovarian Hyperstimulation Syndrome. This complication is quite rare and usually happens in patients with PCOS ovaries. The symptoms are usually abdominal discomfort, some other symptoms such as nausea, vomiting, shortness of breath. The onset of OHSS is usually 2 to 3 days following the oocyte retrieval. So if you have any discomfort, any pain in the lower abdomen, please contact your physician for a checkup. You can continue with your normal sex life during the ovarian stimulation if it feels fine for you. If you feel any pain or discomfort, then stop.